Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. So it's yet another fresh week to start. Monday morning vibes. I understand everybody must be very reluctant to get up from the bed. And last week was a little long weekend. And it's all about working hard. It's all about getting to where you have to be. And today's topic, as I have mentioned, it's an interesting topic that's about the baby movements and its significance to delivery. You know, baby movements are very, very peculiar, and it is very much individualized, and you cannot give hard and fast rules to baby movements. This many people don't know. They keep carrying over others' experiences and expect that their baby also behaves the same way like what others' babies behave. It is sheer comparison, but nothing of that sort happens at all. So when you have to talk about baby movements and what is the significance of baby movements, I'll have to tell you a very important thing that for a pregnant lady, baby movements come somewhere between 22 24 weeks. But then in an ultrasound, when I do ultrasound, we will be able to see significant baby movements like flexion, extension and little movements at about 10-11 weeks itself. And we see small limb buds, the hands and legs, say about 8-9 weeks, and a little movement of the baby at 10 weeks. And at 12 weeks, the baby will be able to significantly move and roll. That is why when people come for an NT scan, that is the first trimester screening scan, which is in between 12 to 13 weeks, 6 days. So during this scan, we'll be able to show them, even if the partner is there around, we'll be able to show them the movement of the baby that is happening, and the hands and legs flexing, spreading out and rolling over, and moving the head down, up, everywhere. So baby movements are very, very good to see, and they're very exciting once they see and watch the baby roll like that and move like that and shift their positions inside the mother's womb. So this is all visualized during an ultrasound by the couple and by them in reality. And they keep carrying over this image, and they would want to experience the baby movements even in future. And when this is all about the ultrasound that I'm talking about, and when we have to talk about the originality of the baby movements, it is very important that you should be able to perceive movements all by yourself, and maybe a small assistance is what we can give. And baby movements are very, very important because the well-being of the baby inside the mother's womb is assessed by baby movements. So that is the significance of baby movements. And especially when it comes to the end of pregnancy, maybe around 36, 37, 38, 39 weeks, that is even more important for the mother who's at home to check for baby movements and the baby's well-being, which is carried over to the doctor's office whenever she comes to the doctor's office. And when do we first perceive the baby movements is a question. For somebody who's first time pregnant, who has a very tight abdominal wall, and whose abdominal wall is is very muscular, and even for somebody who is very fatty also, they will not be able to feel the baby movements until and unless it is about 20 weeks or so. And for some people, what happens is the baby movements are there, but they will not be able to perceive that easily. And It is one thing that you have to watch for, and one thing that you have to look in is never ever uh, you know make rules for the matter. And then early as possible, if this is the abdominal wall, you will be able to perceive baby movements like this. It's like a flicker and nothing more than a flicker. And when you perceive things like a flicker, you will be able to you will not know whether they are baby movements or not. But then again, it's a matter of fact, and it will take some time for things to kick in and to know certain things to happen. And it is very, very important that you do not take things seriously. The more tension that you have, the more in anxiety that you go, the baby movements will not be felt. So it is very important that you are relaxed and then you perceive the baby movements. For any mother who is tensed, for any mother who is irritable, for any mother who is psychologically upset, the baby will stop moving and you will not be able to perceive the movements that easily. So it's a small, simple trick that you are relaxed and the baby also will move. If you are tough, if you are tight, if you are fixed, if you are not able to take your things under control, then the baby movements will automatically reduce. So it is very, very important that you have to perceive things in such a way that your relaxation is always seen and reflecting on the baby. So when it is about perceiving baby movements, for second time moms it is much easier. For second time moms, they in my office they say at 16 to 18 weeks itself that they are able to see the baby movements, they are able to perceive the baby movements, and they are very happy about it, because this time their movements are very much clear and they are very much in sync with whatever the others say. But then yes, their baby movements are very important, and it is different times they usually see. And when somebody comes for a checkup at about 24 weeks, that is the end of the 6th month, mostly everybody kind of feels the baby movements by then. People who are little on the higher side in terms of weight, they will perceive movements little later. And for somebody whose abdominal wall is very tight, they will feel movements a little later. Otherwise, everybody feels baby movements between 20 to 24 weeks, definitely. And for somebody, they feel that it is going to be a hard kick and kind of a thing. Initially, it is not like that. But in the later phase of pregnancy, maybe about 34-35 weeks, it becomes harder kicks. And why is baby movement very important is, whenever the blood supply is good to the baby, whenever the nutrition is good to the baby, whenever the internal environment is good inside the mother, the baby in response to these things moves normally. Okay, whenever the water level comes down, or whenever the sugar level drops, or whenever the blood supply comes down, it will it will restrict the movement and it will not move. So when it does not move, you should be alert that something is wrong. Maybe you are frightened, or you're emotionally unwell, or your sugar levels are abnormal, or the water level around the baby is abnormal, or the blood flow around the baby is abnormal. So these can be a point, in fact, that you can concentrate if it is happening very regularly. Okay, once in a while baby sleeps for a little longer time, you should not be worried. And if just in case, if you have not had a movement for quite some time, you can have some warm liquid, or you can have something that the baby really likes, or some soup kind of a thing you can have. Whenever you have warm liquid into the tummy, usually the baby moves in response to it. Or you can listen to some music the baby likes, or you can talk to the baby in the way that even the partner can talk to the baby and make baby movement come. So these things are there. And essentially, whenever you don't have baby movements, in spite of these things, it is very important that you go to the hospital and check for the heartbeat of the baby. And there is a test called NST, wherein we check for the baby movement along with the heartbeat for 20 minutes of time. So this is very important for somebody who's not been able to perceive baby movements, and there is no way that you check the heartbeat of the baby inside the house. So it is important that you go to the hospital and never postpone the visit to the hospital, that if now I'm not having baby movements, I've tried everything, so it's already midnight, so let me go in the morning. It should never be that kind of a situation. If you have tried everything for the baby to move and yet the baby has not moved in spite of having food or listening to music or doing some small exercises or anything, you should go to the hospital then and there itself and not postpone things for the next day morning. So it is very important that you take action at that moment and do not postpone things, because by the time you try to postpone things, it might be little late also. So it is very important that you check for the baby movements on a regular basis if you have any high risk factors. For somebody without any high risk factors, the baby movements are just going to be very normal and you need not have the apprehension of checking it on a regular basis. You will definitely feel them. And whenever a mother is not feeling baby movements, say after 30 weeks or so, you can get alert all by yourself, that you will always feel, why is the baby not moving? It used to move on a regular basis. So baby's well-being in terms of perceiving movements is very, very important to go through normal delivery and have a very good outcome. If your baby is not having a well-being, that means if the NST, that is the 20 minutes trace that we take of the baby's heartbeat and the contractions and the response to the contraction, that is the labor pains. If the contraction does not give a heart rate variation and there are no movements, say in about 20 minutes time, you have to be alert. So that is an alert line, and we again repeat the NST after some time. If still it shows that, it can be a point of alert that there is something wrong and you have to take an action for it. You just can't say that the heartbeat variations are not there and the contractions are there but the heartbeat variations are not there and the baby is not moving. Then it can be a point of alert and where you have to take a little bit of decision regarding the baby. So internal environment of the baby, including the water on the baby, including the blood flow to the baby, including the sugar levels around the baby, including the environment around the baby, should be friendly, along with the heartbeat that is being maintained on a regular basis to have a normal vaginal delivery. So this is very significant. So we keep telling pregnant women to come in for the NST, the non-stress test, the CTG monitoring of the baby for 20 minutes of time once they hit in about 34-35 weeks, wherein we usually do an NST on a regular basis. But nowadays, since the advent of an ultrasound, the ultrasound examination is much more superior. So when we do an ultrasound, when we see good blood supply, good water on the baby, good growth percentile, and good cerebroplacental ratios, that the brain flow of the blood and the cord flow of the blood is absolutely good. It is much more than a NST in terms of monitoring the baby. So either an ultrasound, which is a very good tool to monitor, or an NST, which is an easy accessible tool to monitor, will tell the internal environment of the baby. And at times babies do become very naughty and they try to sleep for long extended hours and do not move. So you should not have that apprehension. Well prepared, you should come to the hospital and check. And at times when continuous NSTs are not reactive and the baby is not moving and the heartbeat variations are not there and there is something wrong, you have to have a prediction. And there are times that we have seen a very tight cord around the neck, 2 to 3 times or 4 times the loop, and that has restricted the baby's activity. In ultrasound, just somebody who can do a very good ultrasound can pick up these things. And I have picked up one time that the baby was chewing the umbilical cord, and whenever the baby was chewing the umbilical cord, the blood supply gets cut off into the baby, so baby doesn't move. It is only the umbilical cord inside the baby's mouth that was causing a lot of issue. So there are therapies to do to relieve such things. But then yes, for people who are in the outset where they cannot be having an access to a very good quality ultrasound and check what is happening, when the NSTs, when the movements are not there for a very long time and the heartbeat variations are not there for a very long time, they do not take risk making the pregnant woman go through normal labor and have a delivery without the point in that the heartbeat and the baby movements are significantly there or not. So that is more reassuring, and we cannot take the risk of making the woman go through labor and delivery without assuring that the heartbeat variations are there or not. So at times with these kind of findings also emergency cesareans do occur, and it all depends on the setup, it all depends on the person you are dealing with, it all depends on the consultant. Wherein at my center I have people who have training, and even I have training in acupressure points, and we have sound therapy, we have acupressure, wherein we try to motivate the baby and we try to mobilize the baby even if there are certain kind of small problems. And sometimes music therapy also helps, sometimes acupressure also helps, sometimes we have ultrasound stimulation that also helps. So we try all kinds of things to relieve this kind of a problem if the baby is not moving or if the baby's heartbeat is not correct. So it is all in the institute that you are going for checkups, and it is all in the protocols that happen in terms of monitoring of baby movements. And there are places where they do every week the baby movement and the heartbeat testing, that is called the NST or CTG, that they do, because it is very, very significant. In the last few weeks of pregnancy, baby movements are the imprint of the health of the baby. So that is one very important thing that we usually have to monitor when we are talking about baby health and talking about a normal vaginal delivery. Even during labor and delivery, we do the NST traces and we check for the heartbeat variability of the baby whenever the baby is moving. That indicates that the baby is very good in terms of health. So whenever the baby moves, there should be some heartbeat that increases, and then after say a couple of seconds it should decrease to the normal thing. So it indicates that the well-being of the baby is there. The baby movements indicate the well-being, and there is a definitive measure for baby movements. Whenever for high risk pregnancies, not for the low risk pregnancies, for high risk pregnancies, if the mother is having diabetes or hypertension or low amniotic fluid levels or the blood flow abnormalities, or there are multiple pregnancies and all these kind of high risk situations, when the growth of the baby is less and low birth weight babies, we always give them an indication that you have to monitor the baby movements. Say from morning 9 o'clock till evening 5 o'clock, at least the baby should move 10 times. So 10 times if the baby moves, it indicates that the movements are adequate and it is good in terms of the health of the baby. So this charts, we ask them to mark in the calendar and make sure that it is going well. And if the movements decrease or if the movements stop, they have to report to the hospital. And this is just one form of observing the baby's health at home. So it is very, very important that the baby movements are tracked, and whenever the baby movements are lesser, you have to reach out to the hospital, because baby's well-being is very, very important for having a normal vaginal delivery outcome. Just in case of any high risk situations where the baby's well-being is not very reassured, then it will be difficult for us to take the pregnancy through labor and delivery smoothly. You would need extra armamentarium to observe what is happening inside. And mostly a very good ultrasound will be able to figure out what the reason is. But at every given place and time, especially natural birthing centers do not have ultrasound equipment that easily available. So I have an access to ultrasound machine even in the labor room. So any problem, any position of the baby that is not going through labor and delivery that easily, I can figure out and find out what is the reason, and we go systematically accordingly and correct the problem so that a delivery is contemplated naturally. So it is all in the way we monitor things. And naturally, by nature also has given one a very effective mechanism like the baby movement for the mother to understand that the baby's well-being is rest assured. If there is any doubt, you have to reach out to the hospital. And if really there is a problem, then emergency deliveries do happen whenever we have to save the child's health. And whenever everything else is rest assured, you can go forward and you can have a normal vaginal delivery. So it is important to monitor baby movements. It is important, especially in the high risk situations, it is important to report to the hospital when the movements are not there and you've tried for certain things that the movements do come in. And it is important that you need to be watchful to recognize the baby movements, but at the same time you should not have apprehension and you should never have the comparison of the baby movements. Some babies move 10 times in a single 10 minutes duration. Some babies move 10 times in a span of 10 hours. So you cannot compare babies and you cannot compare the baby movements, and you cannot compare the onset of baby movements from one pregnancy to the other even in the same individual. So some people have baby movements for 21 weeks, some people have 24 weeks, some people have as early as 16 weeks in their second pregnancy. So it's all about variation, and obstetrics is all about variation. Obstetrics is all about variability, and it is science. That is why there is so much of variability, and it is never about mathematics. Even in terms of mathematics, when we say that baby movement should be around 10 times in, say, about from between 9 to 5 o'clock, it means that it is a variability and you can have it in 10 minutes also. But then, yes, you just have to be watchful, and whenever everything is normal around the baby, normal delivery rates are very, very high. And that is the significance of fetal movements or the baby movements and achieving a normal vaginal delivery. At times, even during labor and delivery, we try to, do the dilatation process, and the baby kicks us on our hand when the hand is on the abdomen. So that is a kind of response we really look forward for. So if the baby kicks our hand on the abdomen, it means that the baby is doing very well and it is very confident that, yes, I am ready to come out. Why aren't you delivering me at your pace? So it is very important, and these kind of things are really, the science, the nature has given to every woman to experience. And certain women feel that baby movements are disturbing, but no, baby movements are never disturbing, and baby movements have to be enjoyed by everybody. And it is the way that nature and the baby is trying to communicate its presence inside you. And the more you enjoy baby moments, the more you will remember the entire life that, yes, when I ate this, the baby moments were very good. When the partner spoke to the baby moments were very good. And the partner interaction with the baby during pregnancy and the acknowledgement of the moments to the partner and the baby, being the father of the child, is very, very important in overall social development at a later date. So it is beyond doubt that if during pregnancy the partner or the father talks to the child or interacts with the child or spends time with the child or notices the baby movements and feels the pregnancy along with the pregnant woman, along with the good interaction, the social development of the child is very good. The bonding of the mother and child is very good. Mother and the child along with the father bonding is very good. It strengthens the relationship of the child with the father, and social development skills in future are also very good. So that is the significance that people have figured out, even the role of father and baby moments along with the mother. So it's very important that we do not take this topic light, and it is really important that one has to be watchful and not fearful and not in tension. It's just about enjoying pregnancy and going through pregnancy as beautifully as nature has given to us. So, yet another topic tomorrow morning, and it's very important that you stay happy, stay watchful, and stay confident. So, see you all tomorrow morning, yet another super morning with Dr. Shilpi at 7:30.